This is COVID-19 Seattle. I'm Dave Ross.
And I'm Aaron Granillo. 4 of the country's top health officials are testifying before a key House committee today. It is the first time they're appearing together in more than a month to brief Congress on the government's pandemic response. Those speaking include Dr. Anthony Fauci. He gave an update on treatments for COVID-19.
You've all heard of the first successful randomized placebo-controlled trial of a drug called remdesivir, which was used in hospitalized patients with lung disease. It showed a statistically significant but modest impact on decreasing the time to release from the hospital, namely faster recovery. In addition, this drug is now being used in combination with another drug that blocks the inflammatory response, baricitinib. We are also looking at a variety of others: convalescent plasma, hyperimmune globulin, other drugs, monoclonal antibodies, as well as other immune-based therapies.
And CDC Director Dr. Robert Redfield also spoke.
This fall, before the seasonal circulation of influenza increased, I encouraged the American people to be prepared and to embrace flu vaccination with confidence for yourself, your families, and the communities. This single act will save lives.
And if you're wondering, after the president's speech in Tulsa, the other officials testifying before the committee say they had not been asked by the president to slow down testing.
Yeah, Dr. Anthony Fauci said, on the contrary, we will see increased testing. Now, all 4 of these witnesses are part of the coronavirus task force, which are now meeting just twice a week in the White House Situation Room. And they are speaking as, the United States is seeing some concerning numbers out there. We saw in Florida cases surpass 100,000 confirmed coronavirus cases there. Hospitalizations are rising dramatically in Houston and Georgia. Arizona, 1 in 5 of people being tested in Arizona right now are infected, Dave.
And if you look at the University of Washington website, which has been tracking the daily deaths, it's looking like here in Washington we should reach our minimum in August now, and then they start going up according to the projections in September and October. Till October 1st, we'd be back to where we were on May 1st, which is kind of discouraging.
There was, though, some good news from the UW Medical Hospital system. We heard from President Lisa Brandenburg, and she said they're seeing very few COVID patients at their hospital system. Good news there. Unfortunately, we know about Yakima. Not good news there. Their hospital systems are overwhelmed, unfortunately. They've been having to send some patients back here to Western Washington to get treated. Elsewhere, looking at the global picture right now, the World Health Organization is reporting more than 183,000 new cases globally. That was just on Sunday. The WHO's Dr. Michael Ryan says that's the most in one day since the starts of the pandemic.
The increase is not entirely explained through just increased testing. There's some evidence of increasing hospitalizations. This was always a possibility when restrictions are lifted.
Also, we heard from the head of the WHO who said there are still lots of questions about dexamethasone. You may remember that steroid got a lot of publicity last week because it's been shown to lower the risk of death in severe COVID-19 cases. He's preaching caution there.
There is no evidence this drug works for patients with mild disease or as a preventative measure, and it could cause harm.
So all in all, we are in a very precarious state as we've been since the start of the pandemic, it sounds like.
Right. And when it comes to dexamethasone, as Dr. Gordon Cohen has explained to us, that is intended to treat the body's reaction to the infection. So it's not a preventative. It's only of use if you've already gotten the virus. And on the subject of hospital resource use, because that's what it comes down to. Nobody wants to see a repeat of New York. Washington State does not come close to challenging the available hospital resources, even as we get into September and October. But Florida is on a trend line to do just that. If the projections are true, it starts to approach that line beginning in October if they continue at their current rate.
And yet Florida's governor, Ron DeSantis, says they are still going to be staying the course, just still, preaching public health, preaching public safety, but not going to be closing down any businesses at all out there.
Right. They're hoping, I guess, that people will be better about using masks and sanitizing and staying out of large groups in closed rooms, because I don't think Florida is actually that much different from the rest of the country. No state wants to shut down again.
You may recall this bogus vaccine that was created by a man called Johnny Stein. Anyone who got this alleged coronavirus vaccine from him can now get their money back. Our state attorney general sued Stein and his company, North Coast Biologics, for the set of shots he was charging about $400 to administer, in addition to refunds to about 30 people. Stein is also permanently banned from marketing vaccines without rigorous testing and sound scientific evidence. Numerous COVID-19 vaccines are in the early stage of clinical trials, but not one has been approved as of yet.
Well, this is another lesson not to get your vaccines via Facebook. On Facebook, Stein posted that he would not wait several months for health agencies to create or approve a vaccine, calling it something so trivial it took him half a day to design OMFG, which I guess is a medical term for Eureka. Anyway, he also noted coronaviruses are easy as blank to make a vaccine against, except for the fact that his did not work. Here's what Dr. Fauci had to say about it.
I still think there is a reasonably good chance that by the very beginning of 2021, that if we're going to have a vaccine, that we will have it by then.
No mention of Johnny Stein, by the way, in Dr. Fauci's remarks.
And here are some of the reminders from our state attorney general, just some tips for avoiding any COVID-19 scams. Be skeptical because, as you've heard, there is no cure for COVID-19. Don't click on links. They can be malicious. Don't provide any personal information to unknown sources who may be trying to get your personal or financial information.
Yes, don't donate money without researching who's asking for your money. There are many bogus charities offering to help. Visit trusted resources for legitimate information about COVID-19, like government health departments or your healthcare provider. And final tip is, if somebody walks up to you in a crowd and with a hypodermic needle and says, "Would you like this vaccine?" just say, "No, thank you, not now." We will be back tomorrow and every day after with a 10-minute rundown of the daily local news. You can subscribe to this podcast. You can also find our news coverage on mynorthwest.com or listen live at 97.3 FM.